Hello, welcome to Healthy Nation. I'm Pat Murphy. Often, someone who has suffered a stroke or brain attack may experience a change in memory or speech, or even paralysis on one side of the body, making stroke the nation's number 3 cause of death. But did you know that as much as 80% of strokes are preventable? And what you do immediately after a stroke is critical to minimizing the long-term effects. Here's Dr. Paul Knoffelmacher to tell you what's going on in your body to cause a stroke and explain the symptoms that you should watch for.
A stroke occurs when normal blood flow to the brain is interrupted. There are 2 types. The first type are what we call ischemic strokes. This means that not enough blood is getting to the brain because blood clots or plaques form inside the blood vessels. Blood carries oxygen and nutrients to different parts of your body. When blood flow to your brain is blocked, your brain cells begin to die within a matter of minutes. Ischemic strokes make up about 80% of strokes. The second type of stroke is called a hemorrhagic stroke or cerebral hemorrhage. This happens when a blood vessel ruptures and blood spills into the brain, killing brain cells. It is usually caused by high blood pressure or an aneurysm. An aneurysm is a weakened area of the blood vessel that balloons out and can rupture. Although it is less common, hemorrhagic strokes can have devastating effects. When brain cells die during a stroke, some of the basic functions controlled by the brain are affected. These include movement. For instance, paralysis, weakness, or numbness in parts of the body. Speech and communication, memory, vision loss, and even personality may be affected too. In some cases, a person may experience a transient ischemic attack, or TIA, also known as a mini-stroke. In this case, lack of blood flow is temporary, resulting in stroke symptoms that last only a short time. TIAs are warning signs that a major stroke is likely and should be taken just as seriously. In fact, 1/3 of people who have a mini-stroke will go on to have a stroke, so you shouldn't ignore it. A stroke can happen suddenly. So how do you know if someone's having a stroke? I'm going to walk you through a list of signs. You may want to pause or rewind to write these down. A sudden numbness or weakness in one side of the body, specifically in the face, arm, or leg. Severe headaches with no known cause. Dizziness and a loss of balance or coordination. Sudden confusion, trouble speaking or understanding. Trouble seeing in one or both eyes. If you think someone may be having a stroke, the National Stroke Association recommends acting fast by performing the following tests to assess the person's condition. Ask the person to smile. Does one side of the face droop? Ask the person to raise both arms. Does one arm drift downward? Ask the person to repeat a simple sentence. Are the words slurred? If the answer to any of these questions is yes, then time is critical. You should call 911 or take the person to the hospital immediately.
The impact of a stroke may depend on how quickly you respond and get treatment, so always pay attention to these signs, and if you have any doubts, get medical attention immediately.